With us. Hi, everybody. Thanks for joining us on this Tuesday night for our deep dive topic. Tonight, we're going to take a deep look at pain and disease repair. And they're probably a little more associated with each other than you might realize. I'm going to point out a few things that I learned in the process of looking into a deeper view. But there are a lot of people out there that are really sick and tired of being sick and tired. So we're going to talk about living your best life naturally. And we're going to also look at what do prescriptions do to the body. It's kind of interesting. But what we're talking about is treating the cause and not the symptom. And we're looking at addressing physical pain on a cellular level. And most ways that we treat pain tends to be a prescription that maybe helps numb things and it's masking what is the root cause. And we are going deep on this, literally cellular deep, and we are fixing the cause and we're not masking it. It can take a little longer than maybe popping an aspirin or an Advil, but it's sure a lot healthier. And you're going to see why. Because we're looking at damaged tissues, we're looking at a cycle of pain that can be really hard to break, especially if you do start using the pain meds, which we're going to look at. So, healthy cells are really able to handle the stress and the injury and reducing the pain, taking steps to help improve your overall health. Sleep. Sleep is critically important. So, when people are really, injured or after surgery, they tell you, just get all the sleep that you can, more than you normally would, because it's when we sleep that the body heals. And that's really important to look at in your life because if you're a night owl and if you're an insomniac, it makes it harder for your body to purge toxins, to really get in at the cellular level and fix what's wrong. Having balanced diet, nutrition, and Joy was just talking about the amazing Cellular supplement that just came out. That is really, if you're not getting the great diet, putting a 2 scoops of that in your water first thing in the morning is a game changer. Exercise, we need to move that blood. We need to move good things in and bad things out, and that happens through exercise. And then we need to address mitochondrial energy production and where it originates at the cellular level. And these patches we're going to talk about do just that. But before we get to patches, I just want to give you a little background. Chronic pain, that is something that millions of people in our country live with, and that is a growing number. It only gets worse, it seems. And I looked up, what are the causes of chronic pain? You can get in a car accident, it can be life-changing. But there's other things like arthritis and joint degeneration, spine and disc disorders, neuropathic pain, neuropathy, fibromyalgia, sensitization. There's so many people out there dealing with that one, but post-traumatic and post-surgical pain is really a big one. Headaches. I know Joy used to deal with migraines. And then there's chronic cancer related, and other ways that you can be dealing with pain. Maybe it's in your neck. Um, the great thing that we're going to talk about is we have the ability to change the trajectory of how the body responds and regenerates. And so you might be given one of these diagnoses, but it doesn't mean you have to stay with it for the rest of your life. There are, different joints in the body, hip. There's, can be a bone issue. It can be a labrum issue. It can be ligaments. It can be synovial fluid. Um, Beautiful thing when we get into the patches, we're going to talk about how we can address all of those. And I have a girlfriend whose son tore his labrum, was going to put him out for his senior year of high school football, and he was being scouted. And I told her, let's put these patches on him. I think it's going to help. They were sure he needed surgery. And guess what? Between June and September, that labrum completely regenerated itself. He got to skip that surgery. He got a scholarship as a result. So I think that's a pretty great thing. But, there's osteoarthritis. There's many different forms of arthritis. And arthritis really is a culmination of toxins that settle in on the nerves and in the joint. So if we can get the toxins out of the joints and out of the body, and we use the X39 to repair, that becomes, not a past tense problem. And this is something new. We're hearing more and more about parasites these days. I even hear a couple different pharmaceuticals say, tell us if you have a parasite infection. Here's the reality. Most people don't even know they have that. And I'm going to do a future one on these with the help of my bonus daughter, Angie. We've really been studying this. And here's the reality. They're finding that a lot of our pains and aches in our back and in our joints and our muscles, they are actually infested with parasites, little microscopic bugs, worms-like things that are triggering inflammation and pain. And that is just not good. But this is something you just don't hear about. And we're told in our country, we don't have that. That's a third world country problem. But I'm here to tell you that is wrong information from many years ago. That is very incorrect. But there can be diabetic neuropathy pain. And there's different types of peripheral that's, feet and legs, hands and arms. But this proximal, thighs, hips, buttocks, weakness in legs, that's a very big thing. But there's good news and there's hope. You don't have to live with these things forever if you take good care of your body. The body is designed to repair and regenerate. But I wanted to point out what painkillers do in our body because painkillers, we run to them and you go to the doctor. I know when Joy fell down that flight of stairs recently, the doctor couldn't wait to give her a prescription and he was pretty shocked when she declined because she knows better. Because not only are they addictive and it's very hard to get off that pain cycle, they actually they start to do damage to your body, in your stomach, in your liver, in your kidneys. And you can even end up on dialysis from the damage of these painkillers. So think long and hard. And I applaud Jeff. He's very anti meds because of what he's gone through in his health. And he was just sharing us his ice wave story because he'd much rather put on a couple patches that block that pain rather than live with this sensation, and certainly doesn't want to put these things in the body because look at all the different side effects in the body of painkillers, hallucinations, being dizzy, drowsy, insomnia, skin rash, breathing difficulty, diarrhea, constipation. But I circled over here muscular. And what I'm finding is an awful lot of people that I'm helping with these patches, they have been on these meds for years. My mom's one of them. And they can trigger seizures and tremors, tightness and weakness. And they can dry out your collagen and the joint lubrication and the ligaments and the tendons, and they become brittle and hard. And they really create issues. So I wanted to look at some of those drugs that we might be given for another reason that have an impact on our pain, on our damage in the body. But there's 35 million Americans right now that are taking cholesterol lowering medications. And, that might be necessary in some ways. Some people are now finding that it changes the numbers when they do the blood work, but what they're looking at, the bigger pictures, it's really not changing the rate of heart attacks and strokes. So you might, talk to your doctor, do your homework. We got my mom off of hers and her pain started getting better really quickly. Because these are drying out, like I was just saying, the statins are drying out the joint lubrication, the ligament, the tendon, all of those pliable, beautiful muscles and joints that require collagen. So check into that. But then there is number 2 here, isotretinoin. This is for acne. And that is really a bad thing because it's not just drying out your skin so you don't have breakouts. It is severely drying out your joints and your muscles. It also later in life, I know firsthand, it can cause fertility issues down the road too. So they always ask you, do you ever think you're going to have kids before you go on one of those radical ones? And just don't do it, okay? We can help the acne with patches. So much cheaper, safer, better. Um, but then there are these other, I don't even know how we say this one, pregabalin, and it's an anticonvulsant drug. But they find later down the road, it's triggering muscle and joint pain. And just because you took that drug for issues, there's these biofilm bisphosphonates that are treating osteoporosis and bone density issues. But what they're finding is the common side effect of that is bone, muscle, and joint pain. And then there's the blood pressure medications, which I don't know very many people over the age of 50 or 60 that aren't using these. It's just a really common thing. And they're known as beta blockers, and they're prescribed to lower your blood pressure. And unfortunately, what they're doing is they are altering the blood vessels in the heart cells. And that too leads to joint and back pain. So, you know, some of these things we take, we think are, really helpful in certain areas, but they're really damaging in others. I think the best thing is if we can just get people off of these meds, and that's why we do this every Monday and Tuesday night. There is a better way. But 85% of Americans will struggle with back pain at some point in their life. Here's a cool thing, exactly confirming what we're talking about tonight, is they're starting to use high intensity laser therapy. If you don't want to use those pain meds because of the risk of damage, they're looking for alternatives. But here's a cool thing. What we're talking about tonight, I'm going to get into it here in a minute. Um, it's taken that laser therapy to a whole nother level. And we can do a customized care plan for whatever you're dealing with. And it doesn't matter if it's the back, if it's arthritis, if it's an injury, the body knows how to help itself. But, say you didn't want to do those painful, prescriptions that create new problems. The side effect factor is really ugly. What if you went into stem cell injections and you looked into that? And, these can cost, gosh, a minimum I've heard is $3,000. We're typically looking at 3 injections, so that's about 9 grand. And they're injecting millions and millions of somebody else's stem cells into your body, somebody else's DNA. Well, guess what? You can't fool Mother Nature. A lot of that gets rejected. And if you want the very best, the blank stem cells are called pluripotent that can become whatever cell your body needs. You're going out of country for that. You're going down to Panama, Greece, Germany. Very, very expensive. I know Tony Robbins got a shoulder injection recently and it was $35,000. And again, you'll be redoing that in a few years. But we think the best way to get stem cell repair and prevention is through your own body and letting your body bring back the dormant stem cells. So we're going to talk now about LifeWave's X39 patch, and it is known for dramatic pain relief. And it's not just pain relief, it is working at the cellular level with repair. It is helping with reduction of inflammation, a low level of bringing back your own glutathione. We're going to talk about that in a minute. That's a big game changer, especially for those people dealing with arthritis, those toxins that live on the nerves. We're going to talk about how we get rid of that. But this X39 is absolutely fantastic. It's 80% of the sales in this company because it's powerful. It does so much. So, for those of us that are sick and tired of being in pain, we can wear a light therapy patch for pain. And it's clinically proven to increase mitochondrial function, reducing pain and inflammation. And it is doing so much in the body. Best part is it's safe. It's non-addictive. It's no harmful side effects. You don't have to worry about any of that. It helps with the mobility. It eases tension headaches. Just helps with overall body pain. So this is our holy grail, our master cell repair, X39. It brings back a dormant peptide in our body. And peptides are all the rage right now. And there's a lot of them out there on the market that are synthetically made. And here's the reality. You can't fool Mother Nature. They don't always work. And, you might think you get a little boost lift here and there, but it's short-lived. And then the body will stop responding to it because it just wasn't made for the body. It's not the body's natural stuff. We're bringing back our own GHK copper peptide with this patch. When you have enough of that back, that brings back those elevates those those master cells, those pluripotent that can become whatever your body needs. So you're not flying down to Panama to get those. You're getting them in the comfort of your own home while you're driving your car, while you're swimming in the pool, doing what you do, living life. It's happening. It's coming back. And pretty amazing, but it is bringing up that glutathione about 30%. It helps with sleep elevation, working off of GABA in the brain, and so much more. But You'll be amazed when you start using these, what happens. And we always tell everyone this is not a magic wand, some kind of crazy, woo-woo stuff. This is cellular repair. It's a tool to let the body do what the body was designed to do. So you have to be patient, give it time, lots of good water, very important, good nutrients. And again, Cellergize is fantastic. But look at this bulging disc and then degenerative spinal cord here. This is the same patient a few months later. I'm going to talk to you about in a minute how we can accelerate that too. But this lady here, combining the X39 and the ice wave's that pain blocker that Jeff just talked about. And this is helping to relax the body. That's 1 month. Look at how that spine curvature has changed. The body's pretty powerful. But inflammation really has a good role in the body. And the way the body's designed, it's like a red flag. When there's inflammation in the body, those repair cells come seeking it out and they go to work to fix it. But chronic inflammation stresses on the body, and the autoimmune diseases are really a root cause based on, anti-inflammatory or inflammation issues. And we're always looking for anti-inflammatory solutions. But we never know if we're, addressing it correctly. Are we getting to the root cause? What are the other causes? And, sometimes it's skin breakouts. That is an inflammatory response because the toxins can't get out the typical pathways in the body designed to usher them out. So they start breaking out of jail through the skin. But this is the guru of all anti-inflammation things on the market because it's raising a peptide, your own peptide in your liver. It's also coined the happy patch because it works on the autonomic nervous system. So it's not just taking out the inflammation, but we're talking head to toe, brain to all the way down through the feet. It's very calming and just helps with anxiety and restlessness, puts the body into rest and digest mode. That's where the body was really designed to live. That fight or flight mode, when we've got, anxiety and just, jittery, we were never meant to live in that. But we've got a lot of people, especially a lot of teenagers, talking right now about, they just live in this anxiety-ridden world. It's not healthy. It's not good. And this is heat mapping to help you see how quickly these patches can go to work because it's based on phototherapy. That's light. And what you see on the left top quadrant here is hot heat in the body, swelling, orange and red. Not good. We don't want that there. But this is 5-minute change in the body. That image on the bottom, that's a game changer. And then looking at the stomach and inflammation in the digestive tract just melts away. But these are our recommendations when you are dealing with pain. So the X39 and the Eon, they call that the dynamic duo. You always start with those two together. And then if you do have severe pain, the far right here is the ice wave. This is the blocker. That is not a repair patch. It's a 2-patch system. You're using a tan and a white. I'm going to go into that more in detail in a minute. But that is blocking the body pain receptors. And then Alavita is my personal favorite. This is the second most powerful patch that the inventor David Schmidt came up with. It is raising a peptide called epithalon, and it brings back your collagen. Also hyaluronic acid. That's why, we see a lot of changes in skin and hair. Who doesn't want that? But that collagen is really important for joint lubrication and ligaments and tendons and brain, sleep. It brings back your dormant melatonin to get your body into that deeper sleep. That's when the repair happens. And then telomeres, expanding the length of your DNA for longevity. But when you experience how ice wave affects your body, you're going to be blown away. My husband Eric was, because he had a spinal fusion surgery that would not heal until we got this on his body. And we recognized an amazing reduction in his pain. And 2 weeks after he started wearing a combination of patches, we got to go skiing in Utah for Christmas. We skied 3 days in a row with no pain meds because of these little beauties. You can see here, 2-patch system. The tan is up here on her shoulder. The white is placed away from it a bit. And we have to do a little trial and error to find the absolute best spot to put that. So for back pain here, you can see a couple of options. The tan is on the back, the white, they put that above the tan, or maybe they put it on the front of the shoulder too. Think of how an arrow would fly. Sometimes that's the way nerve pain travels. But you can see here the low back, they are bracketing that pain And the white would typically always go on the right of the body and the tan on the left. For knee pain, I got to do this for somebody just the other day. He was hobbling around. I could tell he was in pain, and I said, "Oh, do you mind if I give you some patches? I think I could help you with that." And golly, I patched him up with this, and he couldn't get over it. I also added the X39 and the Eon because I didn't want to just block his pain. I wanted to just get him started reducing inflammation and getting repair started. But we have on our website, harmonypatching.com, a section. If you go to patching, every single patch has a video where you see this circle with the little blue arrow on that Ice Wave pack. If you click that, it will play a video. It will educate you on everything you wanted to know about that patch. And it's going to give you some placement methods. So if you have a migraine, if you have all over back pain or body pain, even, we use that a lot when people have, like, say, MS or a lot of the arthritises. We're putting them on the bottom of their feet, and then we are bucketing them or bracketing them up on the shoulders too. Sometimes we might have to use 2 sets when we're in extreme dire pain. But there is a clock method. There is a circle the dragon. I learned that from an acupuncture doctor who loves these patches and explained that, this is really basically what acupressure is, an acupuncture, but without the needles. We're moving energy. We're unblocking blocked energy. Blocked energy is pain. And stagnant, stopped energy, that is toxins that build up and become ugly, yucky things that we don't want in our body. But the toxins really can create pain. So what we want to focus on is detoxifying the body to get those toxins out of the body and off of the nerves and out of the joints, because that is when these detox pathways start opening. So think of a freeway at rush hour and all the exit ramps are jammed, but you've got, you just drank maybe a bunch of alcohol, or you just, sat in a lot of traffic, breathing in, exhaust. We're getting these toxins, whether we think we are or not. They're all around us. They're in our water, they're in our air. And if you're a gardener, you got a lot of them if you're using things like Roundup and weed killers. So we want to get these out of the body because there are a lot of diseases that are linked to having a glutathione deficiency. And it's so sad to me because I ask a lot of doctors when I go to doctor's appointments with my mom, myself, and I'll ask, do you know anything about glutathione? And sadly, most of them do not know unless you're talking to an oncologist, because typically the last push that they put in that chemotherapy cocktail is glutathione, because they know they just put a lot of really bad stuff in the body, and now they want to open the pathways to help usher it out. Here's the reality. That's synthetic. It's made in the lab. The body doesn't recognize it. And the half-life, whether you're doing it sublingually under the tongue, or if you're taking it by IV injection, it's about a 7-minute half-life. That means full strength. And that's just not enough time to make a difference for some of these conditions. I had hypothyroidism, and I was on levothyroxine for 15 years. And utilizing a combination of patches in 4.5 months, my thyroid regenerated. I don't have that condition, and I got off of that med. I'm on 0 pharmaceutical meds, and I've never been happier. But I've had all sorts of issues on this chart, and I know a lot in my family that have, and I now can say used to have, because we are being able to address a lot of these things. So the pain can be toxin related. And we're going to show you this image here. Now, this is David Schmidt, the owner inventor of this amazing technology. He did a whole talk about people who are bone on bone. And this is his recommendation. It's the X39, bringing back those repair cells. Carnosine, that is a game changer for blood flow and getting organs regenerated, bringing healthy blood with nutrients and oxygen into that space is life-changing. And you have a lot of that carnosine peptide in your brain and in your heart. But if we bring it down here to the knee, we can bring the blood there, and it helps get that Eon peptide elevated more rapidly, because that Eon is bringing that peptide in the liver up to pull inflammation out. Again, remember that amazing inflammation is super important to get out of the body because that eats the stem cells. So if we have a lot of inflammation and we're using X39, you're not getting full benefit. So you really want to use those together. But now adding the glutathione here on the outer quadrant of the joint, we're pulling toxins out. He's also recommending that you use at least 25 grams of collagen protein, and that would be some sort of a bioavailable, like a bovine or some sort you might get from a naturopath, not the kind you get from Costco. That is really more of a marketing thing because that is synthetic. And it's a very, very large molecule that can't really get into the cell like we want it to unless it was in a body before. And that's why the bovine is so popular. But vitamin C is really important too, taking 3 times a day. But my own mom, after 90 days on these patches, she was ready to do that surgery. And we'd already seen a surgeon. She'd had the one knee done. She just didn't want to do it, but she had no choice. She just lived in misery. And around 90 days, she said, you know what? My knees don't hurt anymore. And I get this from a lot of people. My bonus mom, too. She had terrible knee pain and it went away because we start bringing back that collagen, that joint lubrication. We're getting toxins out, blood flow, repair cells. It's amazing. But in 6 months, we went back to that doctor, her orthopedic surgeon. He did new imaging and he said, you don't need that surgery. Your soft tissues are coming back and that looks beautiful. So what's it worth to not have to go through that surgery? This is at Alavita. You can get it as just a standalone patch, but I really recommend this trio because it's a bargain. $150. You get 2 months of that Alavita patch. So that's 60 days. And that's bringing back your own collagen for pretty skin, hair, but it's so much more. It's what's on the inside. But you get a day cream and a night cream that are clean without harmful ingredients. And it's all natural. It's the perfect pH because it's algae based. And I love it. And I just can't get enough of this. And I've had people using it on their feet for fungus control. I've had people using it after sunburns, and it just does so many great things. But your timeline is unique to you, but this is a timeline to let you see what they notice in clinical trials. The first few days, you have 4,000 of your genes that begin to reset to a younger state. In the first 24 hours, I mean, that is like a fifth of your genes. You only have 20 or 21,000 genes in the body, and we're setting back about 4,000. That is a game changer. Because if something runs in your family and you thought you're always going to get, the loss of words or the high blood sugar, maybe you get to skip it when we reset those genes and turn back the clock. We start to see physical, mental, emotional changes in 1 to 3 months, but it's that 3 to 6 month window that really becomes a little more magical for most of us. The longer you use them, after a year, you really are into that age reversal phase. But we need to remember to wear these 1 month for every decade we are old. And what it comes down to is figuring out what we want to be when we are older. We want to be younger. We want to feel younger. We want to look younger. And we don't want things holding us back. And life's too short for that. So I'm going to go ahead and stop sharing. And we thank you so much for joining us tonight. And we're going to stop our recording. We'll be back again next Monday and Tuesday, 6 p.m. Pacific time. We hope you'll join us. And thanks for being with us. And again, take a look at harmonypatching.com to get questions answered, or please get back with the person who invited you. Have a beautiful evening. Thanks for